Hi, hello. I am excited to welcome back Scarlet Spain. How are you doing?
I'm good. Hi, Andy.
Hi. I've really appreciated our talks over the last couple of years with everything related to COVID-19 and having, your expertise as an occupational health consultant for us here at Medics to sort of guide us through all the process. So, it feels like we're entering another stage of the COVID-19 pandemic, and I'm really happy to have you on to talk us through it.
Awesome. Thanks for having me.
So I'm going to ask you kind of a big question, something that has made some headlines lately, and see where you stand on it. So here goes.
Okay.
Is the COVID-19 pandemic over?
Yeah, that's a great question. And you're right, it has made some headlines recently. The pandemic's not over, although we are seeing a positive shift in the fight against the virus. Unfortunately, in the United States alone, we're still seeing about 350 to 400 deaths per day. This is current information. We also are expecting to see an uptick of cases in fall and winter. So it's really important to continue testing, continue treatment, whether that's symptomatic treatment of active cases, monoclonal antibodies or antivirals that would have to be prescribed by a provider. Also providing vaccines, making sure that people are up to date on their vaccines and working on infection control measures.
That's certainly not the answer any of us want to have, right? It feels like it's been forever that we've been in the COVID-19 reality of things. It's good to hear that, we're possibly in a more positive stage of it, but, it can be very confusing at this point to know, how we should be reacting, what people could do to protect themselves, especially as more and more of us are, getting back out there, going back into work, in many settings. I know a lot of people who go in at least a couple times a week now into an office setting or things like that were not doing so previously. So this is all good information as we sort of navigate, the fall and winter months coming up again.
Right.
So with that, I know that there has been some buzz out there, and I've known some people who have gotten a next round of booster shots. And I've also heard some rumblings, seen some articles about these shots being kind of different than the previous rounds of booster shots that were available to the public previously. So can you give us a breakdown of how the new booster shots might be different than the previous ones?
Sure. So the new booster shots are actually a bivalent shot. So what that means, a bivalent vaccine has two messenger RNA components of the coronavirus. So half is that original strain that we were seeing, and the other half is the BA4 and BA5 Omicron subvariant. And this is the predominant strain we've seen for quite a while now. And this is a strain we're also predicting we'll continue to see through the fall and winter.
Okay, that makes a lot of sense because I remember seeing some reports where people were saying, "Oh, should I get a booster sort of back in the spring or the summer months because they had gotten it early fall last year and they weren't sure." And it seemed like a lot of the guidance at that time was, let's hold off. We got a new and improved version coming out that might be a little bit more effective given the new strains of the virus that we had been seeing. So that's kind of the idea behind the bivalent ones, right? That they're going to, pinpoint that new strain while also handling the one that we knew before that, right?
Exactly. And it's really great technology actually. So we've seen the virus mutate, and as we've seen that virus evolve, we are keeping up to date with the evolution of it and trying to get the efficacy that we want for transmission and hospitalizations being down.
Well, it is very exciting to see the, cutting edge of clinical research and healthcare, coming together to help us stay protected throughout these times. And it is, it feels a little bit different now than when we were getting those first rounds of shots and those first boosters, in that I feel like everyone has known someone, on a weekly basis saying, I tested positive. I've got to miss out for this. And it's become, more prevalent in all of our communities. You know someone who's probably gotten infected at some point by now.
Mhm.
So that makes it a little bit more complicated when you think about timing. When should I get my next COVID shot, and when should I plan for this new booster? So, if you're a person who recently had COVID, or someone who recently had COVID and they have some questions around it, like how long after being infected with COVID should you wait until getting that new booster shot?
Yeah. So first I'll talk about just eligibility for the booster.
Okay, sure.
So age with the Pfizer BioNTech, age 12 and up is approved for the bivalent. With the Moderna, it's age 18 and up right now. That may change the next month with other age groups coming into play there. But the eligibility is going to depend on the age of the person, when you completed your primary vaccination series, when your most recent booster dose of a monovalent COVID-19 vaccine was. And then to answer your specific question, when you are looking post-COVID, that you've had an active infection, the current CDC recommendations are to wait 3 months from when your symptoms started or when you tested positive.
Okay. That's very good to know, because obviously you don't want to be going in while you're sick. That's never good for anyone.
Right.
But then there's that question after the fact, because you just don't quite know as far as timing. And it's, it used to be that we were doing it hopefully to never get COVID. And now we've gotten to this point where, okay, you've probably been affected at some point, possibly in the last few months. So good to keep track of those dates, and know where you fall within that spectrum. And for, those with children and people in different ages in their household and loved ones to kind of know, okay, who can get it now, who might be in line in the future, and all those eligibility requirements.
Yep.
One other thing I want to note is that, unfortunately, COVID does not exist in a vacuum. There are other illnesses out there, and wouldn't you know it, there's a crisp feeling in the air outside, which means it's flu season, steadily approaching. And, none of us like getting the flu, but for some, just like COVID, it can be pretty deadly. So, flu shots are obviously recommended for those who are at risk, but, for the general community as well, to help kind of fight and, build up protection for the common flu virus as it's going around. So, we've got the opportunity to have flu shots. You've got the opportunity to have COVID shots in many places. You go to a pharmacy, they're offering both. My question is, do they mix? Is that something that you could be going in and getting both at the same time, or should you separate them? How should you approach the flu shot and let's say a COVID booster?
Yeah, so I would have a discussion with your individual provider. You definitely can get both in the same visit, the COVID booster and then your flu shots. With flu shot, geographically, it's going to, when you expect to see a peak, it's a little bit different. So the timing of your flu shot should be aligned with the time frame that would allow you to have the best antibody response during the beginning of flu season. So again, talking with your provider, looking at data from recent years to determine when cases historically peak or spike in your area. The standard rule of thumb is to get your vaccination for flu 4 weeks before the beginning of flu season. So here in Chicago area, it's time for people to get their flu shots, and with many areas in the country as well.
Okay, that's good to know. And it's part of it is convenience. If you can get them at the same time and it works for you, that's fine. But having a little bit of that guidance as well to go in, because I know the first time I was going in to get a booster shot, I hadn't even considered that as a possibility.
Right.
Oh yeah, maybe I should. And then you're starting to think through, okay, wait, which arm do I get them in? Do I get them in both arms? And it's a whole thing. So coming in prepared, if not only to make you feel a little bit more comfortable and confident in the process, but like you said, using that data to make sure that you're getting the most out of both shots is a really good idea.
Yeah, but there's no current recommendations say that you can definitely do them in the same visit. Last year when I got mine, it was very close to each other. Or it may have been the same day. I don't remember exactly. So
yeah, there you go. Well, I appreciate you, joining us again to talk about COVID. Not that I love talking about the topic. Obviously, it is concerning that we, continue to see people being hospitalized, deaths related to COVID-19. But as you said at the start of this conversation, hopefully we're turning another corner in the COVID-19 pandemic and doing these small steps such as getting the next round of booster shots and, staying safe during these high risk seasons like the cold and flu season will help us, get out on the other side for a brighter year ahead, right?
Yep, for sure. As the weather turns colder and immunity from previous vaccines, whether it's flu shot or COVID, we're going to start to see that immunity start to wane. So it's a good idea, definitely, to stay ahead of the game and protect yourself and your loved ones.
Well, thank you so much for sharing your expertise with us, Scarlett. And, I'm really hoping that, we connect again sometime soon and it's
Yes.
about a very positive, development. Maybe, by then we'll have even better news about COVID-19, or we could talk about an entirely different topic altogether, because I know you're a wealth of knowledge and we always appreciate hearing from you.
Awesome. Thanks, Andy. Bye.
Thanks. Bye.